MHSSP, a project that aims to improve management capacity and quality of health services in the state. As we continue to battle one of the hardest challenges in the history of health, this project is a welcome change and has come at the right time. The COVID-19 pandemic has hit us hard. We don't know how long we are going to put up with this fight. And while the general population is able to stay home for the sake of their own safety, healthcare providers continue to battle at the forefront, risking their lives. And in the midst of the chaos, risk, and uncertainty, majority of our public healthcare facilities continue to provide non-COVID essential services. The launch of MHSSP, with its promising objectives, will undoubtedly bring renewed assurance, safety, and security to the people of our state. I would like to mention that this event is being broadcasted live on our department's YouTube channel, as well as on Zonet cable channel, and we are also live on webinar. So a very special welcome to all the virtual participants, as well as our viewers on YouTube and Zonet. Before we begin our program, as a token of our appreciation, we would like to present bouquets to our VIPs, to our three VIPs, And for this, I request our ushers to kindly come forward with the bouquets, please. Thank you to our officials. And now, to begin the program, I request Pularam Haka, Special Secretary, Department of Health and Family Welfare, to kindly deliver the welcome address.
Our dear Chief Guest and Honorable Minister, Health and Family Welfare Department, Dr. Arlal Thangliana, and Chairman, MKHC, and President, MHEP General Headquarters Aizol, and President, MOP General Headquarters Aizol, and Ms. Trina Ishak, Practice Manager, HNP, which is the Health, Nutrition and Population of the World Bank, and Mr. Batula Amit Nagaras, TTL, World Bank, who is the task team leader, and special invitees will have special item such as Dr. Christinazo Nunmoy, Medical Officer, Lungsen PHC, and Dr. Lan Nunpui, Lunglei District Hospital, and Dr. H. Lalchungdunga, Director of Health Services, Dr. T. Lalmangai, Director of Hospital and Medical Education, and Dr. Eric Zumoya, Project Director, MHSSP, who is also the Mission Director of the NHM program in the state, and other colleagues at the MHSSP, and other distinguished guests, and ladies and gentlemen. A very warm and hearty welcome to you all. At the outset, let me express my heartfelt thanks for the opportunity provided for addressing this August gathering during the launching of the Mizoram Health Systems Strengthening Project. I am indeed privileged to take part of this launching program, as it provides an opportunity not only to reaffirm the trust and commitment of the government of Mizoram in providing quality health care for all, but also to reiterate the importance of the health sector reforms in the state. I am also thankful to the World Bank's team for working closely with our government and ensure that this project is given shape. This is the result and effort of numerous discussions and deliberations of both the bank and our government teams to ensure the development of a comprehensive service delivery package with quality health care to all the poor and the needy. Mizoram State, as we all know, has many requirements. We need support in refurbishing our buildings, our infrastructures, and we need support in procurement of better equipment with newer technology. Rising cancer cases have put Mizoram on the cancer map of the world. We have some of the highest number of cancer cases despite being a small state. We need help in building the capacities of our healthcare staff, enhancing the insurance coverage to those who have not yet enrolled in the Mizoram State Healthcare Scheme, and lastly, but more importantly, working directly with the communities. The healthy individual or healthy family is the ultimate goal of this MHSSP, which will result in having healthy communities and therefore a healthy Mizoram. I am glad that all of the components have been under threadbare discussions and they ultimately found their rightful place in the project documents. It also gives me immense pleasure that the teams have started to work together, and further pilot initiatives have also been rolled out, and the results and learning from this will be disseminated and fed into the larger schema of the project. And it is not just the speed that this project has caught up with, but I am also excited regarding the innovative procedures which will be developed and designed, and our way of doing business will be revived with that. I am sure that our entire workforce, from the directorates to the last facility in the hard-to-reach district and remote-test villages, will make use of these talents, skills, and advances that this project will bring about. I request all of them to put in a little more effort and therefore learn, contribute, and make this project a success. It is never too late to learn and improvise our health systems. It's also a tremendous opportunity for us to create changes in our lives and change the health negatives of the states. It is critical that the members of these two directorates, such as the Directorate of Health Services and the Directorate of Hospital and Education, and different units at the district and the sub-district have strengthened sub-district level, strengthened their coordination for success of this project. Coordination is one of the vital component of any project for successful implementation, as we all know. So, if there is one mantra, one keyword for success in this project also, I would say it is coordination, which will be vital for everything. The entire project documents underlie the importance of coordination at all levels. The finance department has to coordinate with the technical teams and vice versa. The key focus for this success, therefore, lies in coordination. and to have successful coordination again, everybody has our respective roles to play. So we must know what our roles are, and it is most necessary that the attitude we have in implementing or actualize those roles as envisaged in these project documents are well understood and received with open hearts by everybody concerned. The bank has also supported the project with a young and dynamic project management unit. The PMU team consists of the localities who are trained to support the implementation momentum. The key role of this PMU will be to bring all the stakeholders together to ensure the project meets all the desired deadlines and any perceived bottlenecks are quickly addressed. In conclusion, I'd like to emphasize that the performance of all staff, right from the headquarters to the last facility, needs to support the project implementation and make it a success. Now that the World Bank and the Ministry in the Government of India, the ministries concerned, have done their part generously in offering us this opportunity to improve our level of health system and our views and our service quality also, it is our responsibility to make it happen. That is what I would like to stress in this event. And with the joint efforts and coordination of all concerned, the Mizoram Health System Strengthening Project will provide care for the less fortunate, bring consolation and new hopes to the poor and the needy of the state. This is the most important, one of the most important things, the most important goals. Because, for example, we may have a high standard and high-tech facilities here in Aizawl, let's say. But if the remote villagers, the villagers in the remote area cannot avail those benefits, the success will not be complete. So the previously lack, whatever those may be, will be met with the help of, under this health system strengthening project. So that is one of the most significant point to my mind. This project will make happen, and the benefit to be reaped by the poor people or the remote villagers is one of the many things which make this project more valuable. I hope and pray that the Lord will give us wisdom to make this project a success. Thank you again. Thank you.
Thank you, Puarlaram Kaka, Respect of Health and Family Welfare, Government of Mizoram. And now to devote our program and lead us with a prayer, I humbly request onto the stage Reverend Dr. Silal Lira, Chairman, Mizoram Kaushan Shuaitu Committee.
The Health Minister of our state, Mizoram, Dr. R. Leltangliana, and Mr. R. Laramaka, Secretary, Health and Family Welfare, and friends, I'm very glad to have been invited today to. Reading is from 12. I'll read first in Mizo, and then I'll read again in English for the benefit of those who do not understand. Mitin until tiang zelin le chang som pani thu sang som pani som pathum ten som pani te chu akova pani zelin atir chuak ta a ram huai bol ho te chunga thu nei na ape boka ti chu ram huai tam tak an no chuaka tin dam lo tam tak chu riak an noya anti dam boka. Let me switch over into English. Proverbs 24:11 to 12. Rescue those being led away to death. Hold back those.
Greetings to all of you from the Mizoram Health System Strengthening Project. It is a great pleasure and an honor for me to be standing here in front of you as Project Director of MHSSP to share with you a brief report on what this project is all about. I thank the Honorable Health Minister of Mizoram, and also I thank the World Bank team and Government of India, especially Department of Economic Affairs, for making this project possible, which we hope will herald a dawning of a new health systems in Mizoram. With the permission of our guests and those from the World Bank, I'll be continuing this project. I'll be continuing making this presentation about this project in Mizo for the sake of the larger audience. Mizo tongin ka soito maya nga. Hey, kan project ming hi Mizoram Health System Strengthening Project ania siat po ahar ang reng viawa han lampo hara MHSSP kan tia World Bank project ti khan achiang de bermai ome kha kan siat lardana nia next. Hi atrantir ber hi han soita ila story thuita kanaya journey thuita kanaya he systems MHSSP only to dihan he kan Honorable Health Minister hi amala tu ber asul sutu berani ta chuan hei thala kan hmuang hianin ani hian country director le officials World Bank ami te New Delhi ami kha sangni le som pakwa kumlai holvel khan hei Dr. Tluangin en anzu mu anzu soi puya World Bank ho pe chuan an lo soya kan hena po in Honorable Health Minister in chiang takin in challenges neite aron soya adu dan te po aron soi chiang anti chitiang chuan chu mai chu du to lo in Washington DC kan Honorable Health Minister hian azubo zui boka an headquarters tiang chuan kan journey hi alo in tanani next khi thui ang reng khop maya han sei vek don chana maro chu kan sei thok thoka nga March nisom ni 22 kha World Bank project kha toy join soita ila DPR te thelu ani in katiang nuwa khan screening committee of Department of Economic Affairs Ministry of Finance chuan World Bank ka thon turin refer turin an lo pomta sta chuanin World Bank ka thon ani nakhala chuan World Bank chon mun takalo zir chiangin approval kha World Bank chuan DEA Department of Economic Affairs chuan April ni khat khan an pevele hala chuan thilti tur tam tak ti fel tur tam tak oma chung chu ti zo ani nu khan Mars ninga sang ni som ni pakhat kumin khan negotiation meeting on loan and project agreement kha New Delhi representatives of Department of Economic Affairs Ministry of Finance tele World Bank le Government of Mizoram ayo in kan zukal ani achitiang chuan negotiation meeting kan neya loan and project agreement kan neya kan sign fela chuan chumi chu World Bank lampangin achung lampang ten an lo thlir vele tiang chuan Mars ni som thum pakhat sa ni som ni pakhat khan Board of Executive Directors of World Bank International Bank for Reconstruction and Development IBRD 10 an lo pom vele ta tiang chuan June ni som pasari khan a final signing loan agreement akha kan nei le ta hei chu online in ani to DEA World Bank le Government of Mizoram tenen chuan July ni som pathum atang hian he kan project hi effective ta ni ti World Bank khan anon puang ta ni. Next, hi Mars ni thum Mars ni nga kumina kan zu sign ani tiang chuanin DA alai mi khi DA on ni piaber dinglam pangber hi World Bank Mr. Bathula Amit Nagaraj ani hi task team leader ani chuan tiang chuanin laya online in Finance Department Mizoram Government of Mizoram te po in lo thirin tiang chuan engem mazat in lo tel ve in tiang hian sign anita ani. Next, chuan he project hin ye zona tam thei khop ba han soifiata ila asum vel involvement akha $40 million project ani 32 kanti 40 tila digzok hial oma chuta chuan $32 million hi 80% achu World Bank atang loan kan lak tur kha anita ani chu World Bank in fund on $8 million 20% hi state government ina atum tur kha ani chuan project percent state ina kan tum ve tur po hi interest hi chu Ministry of Finance te state government na la in negotiate la sai ho tur ani chu wang chuan 10% chok ha kan rul tur ani ti kha loan a khan kan shiat apoi mo ani chuan repayment of loan hi September 15 2026 atanga tan tur ani kumnga project ani angkhan 2026 thleng ani chu mi hnuah chuan kan rul tran anga kum som pali le thanga chungin rul tur ani. Next, a budget distribution ki alai ki en masata ila input based financing kan ti hei chu state sarkarin kan du na tele input kan pek atang te trul kan ti anga tang khanin kan man thei tur kha 65% ani chuanin 35% kha results based financing ani nakina kan laron soi chianga hi kan performance ho zong kha ni chu work satan hemi 65% atang hian 45% ale chhong kha works nan kan mang thei dona tin consultancy firm sei engmozat kan roi pali nakina kan clear ho nga khang te po kha atan khan ani services kan ti te goods kan ti te HR kha atan khan ani dona tin dinglam panga results based financing hi a break up to dinglam pang bera hian omle ta hi hey state 5% ani state kan ti chu directorate level 5% ani anga district level CMO level khan 10% akalanga abazong 80% community 5% ani anga facility level khan 80% kha kan mang thei don ani. Next, Mizoram hian kan shia Mizoram chu ram dang state dang sangtlung tak te ngai to chuan kan la no panga kan omna remote kan la changkan kan la in changkan hle ma chu wang chuan kan ti thavio Mizoram healthcare te po ti thatna tam tak kan nei small state te po lomman han don chang te po kan nei ve thina amor chu kan thewa kan healthcare system te state chang lungzok te ne na kan in changkan hle ji chu kan hrianga chu wang chuan challenge tam tak kan la neya management lampanga te po kan capacity te at claima financing le accounting system te budget process te tin indenting le forecasting kan ti te procurement supply chain management ti ang chi te le biomedical waste management te du angin kan la changtlung tok lova tin quality assurance systems te po hianin national quality assurance te po accreditation te dong thei kan lom mang lova civil hospital ina andon te khang ba ka khachu UPCITI den kan andong vele khatiang ba khachu kan la ti hlei thei lova chu wang chun quality assurance na sa takin halak tur kan neya tin HR human resource lampanga kan la changtlung lo hle a specialist te kan la nei thalova HR policy policy te po hi kan la nei mu mal lo hle a tiang chuanin tin kan skills te po han ta thiama han englo tur chuanin system kan nei mu mal lo hle a chuwang chuan khatiang kha ani a challenge tam tak kan nei ani tin in health insurance scheme a po hian tam tak kan nei a challenge beneficiary enrollment claim a 55% vel chok te lo ni a tin awareness te po du angena thatok lova tin reimbursement te po delays te kan la nei lo thei lo khatiang khan challenge tam tak oma heng hi World Bank project through hianin MHSSP kaltlang hianin address tu mani don ani chuan next key project objectives kan thil tum abera khachu management capacity directorate level ani emo CMO level te poni anga khangan management capacity khati changtun kan tuma tin heta facility level quality of health service kan pek mi puite health service kan pek kha ti choi kan tumboka kha ani tin heta poimo de mai kan man ruwa tur chu internal performance agreements ani IPA hi kan han sei chiang zau de du chu ni chu tiang chuan a management ba ka khan a service lampanga khan ti changtlun he project hian atumani next components pali next slide please tiang chuan in component pali oma he project hianin component 1 chuanin khami management kan tia kha address don chu internal performance agreements IPA khana address don ani pakhat na chon hei 13.5 million vel anda ani component 2 chuan state health insurance program khang a coverage ti san tele a functioning te han ti thata kha 2.5 million vel da ani tin component 3 chuan quality of health services ti chuan atam theng thil tam tak om thenga innovations and support te khanga khanin kan health HR and training han ti tangtung ten skills han ti thatte an service han ti thatte tin henga hen works te po atel the biomedical waste management kan ti thleng po khan chu ni component 4 hi chu emergency ta na dania budget po da ani lova hi chu engemo emergency tak lo om ta se pandemic ani mo thil dang te po health ina health department ten poimo kan ti khat chu khami kha address thei dona adanga tang hian a so hek mai dona ni next hey sang kha component sang kha toite in han soi kan tu manga pakhanna chuanin management component 1 kha management le through IPA kan ti khami kha directorate of health services te directorate of hospital medical education te Mizoram state healthcare scheme te kha ankok ta de hleka he kan scheme hi kan soi du chu directorate te le CMO te kha tiang kha ni lo apum pui health system shim khoi tur ani awang khan a huab zau mati kan zawaya ta ani kan zawaya ti changthlun na tur ani kan hemi World Bank project team big ta ni lowa ti kha kan share tring anga ya chu wang chon kan zawaya tan ani ti kha kan sei non duatin district level health administration te district hospitals te khatiang kha ani anga chun health facilities PHC te CHC te tin sub center te thlengpon a khoi thei dona khatiang khanin state level chuanin engamo indicators sang amanga timely resource allocation ti te policy reforms procurement and supply of drugs kan ti tha ti te khatiang kha en turan ta district level apo improve monitoring and supervision ti te coordination support for supply of drugs institutional level review for BMW ti te quality improvement and accreditation process anti ang chi te chi sang khoma facility level apo quality of service delivery biomedical waste reporting and documentation improve clinical skill of medical staff ti te khatiang kha alo om ta tlang pui thu ani chuan heng puisa kha kan pe ทอนกันเป็ดตบโดนโลนี่ข้ามีปอยสาข้า IPA อินะตุมาจูข้าปอยสากันเป็กตุรก็โหลอันโหลดชัวเวงไงตานี่ Directorate เนี่ยโมเฮต้า hospital เนี่ยโม CMO level เนี่ยโมข้าที่ยังข้าอันโหลดชกตัวจนแห้งทิลกันเสียแต่ข้า performance indicators แต่ข้าอันตีเฟลเวพอดข้างไงข้างอันตีชัดดานะจรินปอยสาแต่พออันดงอินอันดงหันเสียเลยแต่ลูกอีละstate level กันเสียตัวข้า directorate level ข้าจวนอิน29 topics อมโดนะ17ข้าจวน one time มันยัง12ข้าจวน recurring อันนี้โดนตานี่ข้าจวนอีโฟตัวอันที่นั้นไว้กันเสียมันลงe-payment of salary หันที่ยังจีเตตินตูร์บิกเตกันนนที่โดนะ clinical view อังจีเตจิช่างข้าอมโดนตาที่ยังจวน facility level next district hospital เฮียน20 ขัดและ25 recurring อันนี้hospital ไปจนตั้มเด็กเล็กให้ essential medicine stock and maintain time toilet hygiene BMW score citizen charge IPA นะตุมาชุนี่ปอยสาอินเป็กปากขันปอยสาหักันมันนัตูร์แพลนกันเสียมังมุมมันตะกินจู่ๆผมมันอีจวนข้ามีเสียมนะหักันมังเละงาลเทบกังจู่วังชวนdouble in improvement ค่ะอมโดนอันนี้ program design และ management เตpolicy และ design เตcapacity เตหัน strengthen ค่ะนี่community interventions เตพอ enrollment เตขัดยังอังคารตินเองติดช่วงเงี้ยอันนี้จินเฟลเทที่ยังจีเตข้างเตค่ะโน่นนี่ส่วน number 3ส่วน quality of health services และ innovations เฮียนทิลตัมตักอเล็งเทียงสุดท้ายส่วนนี้เงี้ย health facility improvement ลำปังworks เตปอเขาเทียตัวกันง่ายติน diagnostics ลำปังหัน strengthen เตตินเงี้ยนี่ repairs and ละเสียงตัวอันนี้ healthcare ดาร์สตานขัดยังขันตุ่มจุนิตานี่ next project near results framework ส่วน result กันหูตัวราคาให้สุขสัยทุยลุตุกลงมา project development objectives ช่างกันเนี่ยขัดขันIPA กันตีเตติน quality index score for district hospitals และ CHCs ตีเตpercentage of targeted public health facilities getting national quality assurance certification ค่ะกันละในมังโลกติค่ะresults framework objectives เตปออลอมเวเลยข้างข้าช่างข้างข้าก็สุกันใส่ detail ลุตุกตัวลงไม่งะ next การ implementation mechanism ฮีป่วยหมดมาที่ project steering committee จุงเปร่าตาให้ chief secretary หน่วยchief secretary chair นะอันนี้project steering committee ส่วน department ช่างเตเขาตัวช่างเตอันมาที่นั่นดดเลี้ยจวน project executive committee PEC มาให้ secretary health and family welfare นะเขาบอกว่าแต่เฮียน health department นักการเขาตัวเรียนเตล finance ลำปังเขาตัวเตอันนั้นบอกว่าที่ project management unit PMU ฮีกันเวียให้project director นะเขาว่าแต่เฮียน technical assistance กัน partners เต็นเองว่าจะมินเปที่ยังชวน deputy project director ให้ดร.ลวงอีบอกว่าขัดยังขันให้มินหัวขันินHR ช่างเตกันในเวนี่ next ตัวนั้นเห็น consultancy firms ที่ปลีในตัวกันนี่ประคัดฮิตเลยมินเองมาวางินกันหันevaluate เมกอันนี้ฮิจูส่วนประคัดน่าส่วนนี้ project management และ technical support มินเป็นตัว BMTA กันที่ข้ามีต่างกัน project กัน manage ต่างชิมแต่ technical support มินเป็นตัวข้า IQ via consultancy น้องมาให้เวน่าอันมานี่มีเลสับเองมาจัดอันออกมาส่วน developing strategy and management framework for human resources for health HRH human resource big ไงตัวต่างกัน IQ via น้องมาให้ตัวน่ะปนหันถกชนะ office ช่างแต่พออันกลางกัล secretary แต่พอนุ่นกัลให้มีฮีกันเนมให้ฮีtransfer policy กันเนมอย่างนี้ขัดยังสิช่างค่ะกันนั่นคนชนะข้า kan soi hal do chu lo cooperate thaviau ula kan ho tu te pokhan ti kha kan zawai ta ni a policy kan nei mu mal lo te khasiam tum ani a transfer policy te a transfer norms enge ni kaisan na tur ti te khati angchi enge mo tha chi sang kha nanon khong kuala aboi kha ran khom mai he kan lo nei tlem nge ni kan hu zo lo nge ti vel kha atam ya chu wang chon heng atang po heng improvement na tur kan nga ti kha kan han hu hal pang ani chuan adot le chuan improving clinical competencies khamia kha clinical vintage te po kan ti a ani po in pon lo train on verify nga kan performance te kha adikem the diglovem ang chin nge kan ti te khatiang kha project evaluation ti te khatiang ti tu kha sutra consultancy anom boka hei voina aingam zat anom boka nian mani po next chuan key stakeholders he top trap minute ni khat chia to do na key stakeholders chuan state level a khan DHS DHME big takin lo ni a tin hamia hi chuan in ki internal performance enge kan ti tur poimo deu te kha lo no taila internal performance agreement implementation kha poimo dona tin counter verification of facilities HR enumeration ti te training need assessment hei poimo dona training kan mo dan te strengthening biomedical waste management ti te functional review for HRH policy strategy ti te procurement policy specialist services low cost medicine outlets comprehensive communication campaigns on health ti te alo ni a heng te hi keimani siam chap ni loven tianga wide consultation nei chunga tiang kha lo ni a chuan Mizoram State Healthcare Society te internal performance agreement strengthening policy and design increase insurance coverage converging benefit package IT architecture ti te lo ni a CMO le district level IPA implementation and verification ti te HR enumeration training need assessment ai tuna po engamo anon ti thana assessment te chuan biomedical waste management ti te comprehensive communication campaigns ti ang chi te lo ni a tin district hospital te sub district hospital CHCP te contingency emergency response component ti te IPA ti te kha poimo zolte ani next John stakeholders dang anoma kha health department chung de te po alo ni a stakeholders the community sa poimo hle mai hi community engagement hi chuan kan beneficiaries turte VHSNC kan ti te self help groups kan ti te kha kan ngai poimo don ani tin other departments UDNPA MSPBCB ti ang chi te environmental forest ti ang chi te le di le chi sang dang te po IMA NGOs te kha abik takin biomedical waste management ate kanin converge ngai te anni don ani next kha kan sai thei tlang pui chu ne ka lo me.
Thank you, Dr. Eric Zomoya, Project Director, MHSSP, for the very precise yet insightful presentation. And I think we all have a clearer understanding of what MHSSP is all about. And now we have a very special message from Ms. Trina S. Hub, who is the Practice Manager for Health, Nutrition and Population Global Practice under World Bank. Trina ma'am is responsible for and looking after several countries, including Afghanistan, India, the Maldives, and Sri Lanka. Since she could not be here with us today in person, there is a message she would like to convey on the occasion of the launch of MHSSP. I would like to request Dr. Nunsang Zela, consultant of MHSSP, to kindly read the message on her behalf.
Dear Dr. Arla Thanglina, Honorable Minister of Health and Family Welfare, Government of Mizoram, Mr. Landon Moya Chuangol, IAS, Chief Secretary, Government of Mizoram, Dr. Til Mangai, Director of Hospital Medical Education, Government of Mizoram, Dr. Ishla Tungnunga, Director of Health Services, Government of Mizoram, Dr. Eric Zomoya, Project Director, MHSSP, and other colleagues at MHSSP, Chief Medical Officers, champions, my colleagues from the World Bank, PMU staff, other distinguished guests, members of the media, ladies and gentlemen. It is a matter of great honor for me to be part of this launch of the World Bank-supported Mizoram Health System Strengthening Project today. I would like to convey my special gratitude to the Honorable Minister of Health and Family Welfare, Government of Mizoram, in consenting to grace the occasion of launch this important project. Due to the current COVID-19 pandemic situation, we are all meeting together online, but I hope and wish that soon we will overcome this pandemic and will be able to travel freely. I would like to visit the beautiful state of Mizoram and meet you all personally. The Mizoram Health System Strengthening Project is expected to significantly support improvements in the access to health services, as well as their equity and quality, with expected positive impacts on the life of the whole population of the state. The occasion of this launch is an important step towards project implementation and achieving the agreed results. I am glad to learn that there have been considerable efforts by the Health Department officials to reach this point, including numerous online meetings with the World Bank team and virtual walkthroughs to various facilities in the state. This shows your commitment to start strong and gain implementation momentum. Let me focus my remarks on some of the key dimensions of the project. First, I am informed that much progress has already been made on the development of Internal Performance Agreement, or IPAs. These IPAs will enable the improvement of hospital efficiency and quality of care, as well as strengthening their management and governance. I invite all partners to join hands and continue to develop workable and successful IPAs in the health sector of Mizoram to spur improvements across the system. Second, we know that the lack of access to health insurance and the burden of out-of-pocket expenditures on households are intrinsically linked. Therefore, to enhance financial risk protection against health conditions, this project places considerable emphasis on tackling challenges to enhance the coverage and enrollment of the population in efficient health insurance schemes. Third, given the geographical hilly terrain of Mizoram State, we know that private health facilities are few and far between, and that the lack of medicines and diagnostic services in government hospitals leads to high out-of-pocket spending by patients. This project will ensure that public health care facilities are better equipped, medical staff are well trained, and system pathways for cross-learnings across these projects and states, and sharing of best practices which are mutually beneficial across the Northeast region. Indeed, our expectation is that this Mizoram project will be a lighthouse project, contributing to innovations and health system improvements not only in the state of Mizoram and the northeastern region of the country, but also for other states in India. Let me conclude by noting that the Mizoram Health System Strengthening Project is an indication of the World Bank's commitment to a strong and enduring partnership with India in its overall development efforts for all its people. We look forward to continuing this collaboration with India and with the state of Mizoram. Thank you.
Thank you, Dr. Nunsang Zela, consultant, MHSSP, and those were the words of Ms. Trina S. Huck, Practice Manager for Health, Nutrition and Population Global Practice, World Bank. Next, we have Mr. Batula Amit Nagaraj, who is the Senior Operational Officer at World Bank and also the Task Team Leader for MHSSP. Sir too could not be here with us today, but I believe he is on webinar, so I would like to invite Sir to address the audience. Sir, I think you're on mute. Sir, kindly unmute yourself.
Good afternoon, everyone.
Samit, we can hear.
Hear me? Commitment the leadership has shown, and also the staff for the PMU during the whole course of preparing this project. And I still remember the day when Honorable Health Minister met us at the World Bank office in Delhi. And thanks to Dr. Which refreshes the memory. He shared with us of the future health system for the state, which is quite resilient to the shocks, more efficient, and put public at the center of public health function to ensure good health of mesos in the state. And see, here we are launching this one of the most innovative projects. Externally aided project need to have development. And I expect the same from the government of Mizoram, because the 5 years project will probably help us in terms of setting the state basic fundamentals, which will help you in terms of moving the state has. Leadership and the management have a critical role to play in the periodic review of the project activities and provide necessary support.
Management and accountability. To help us understand what an IPA is, an audio-visual clip has been prepared. Let us have a look at the IPA teaser.
Hello everyone, I am Dr. Victor. I am posted at a PHC. It feels great to serve people every day, and I try to provide my community with quality healthcare. As we all know, there are quite a number of challenges to run a health facility effectively. We struggle with providing best possible care for people. We suffer from shortages of staff and have to deal with some management issues too. I am aware that the government of Mizoram is committed to improve the healthcare system by launching Mizoram Health Systems Strengthening Project. But I am keen to know how these challenges that I am facing at my facility will be addressed by this project.
Internal performance agreements, IPAs, are ways to bring resources, boost performance and find solutions at your facility. Internal performance agreements or IPAs are the highlight of the MHSSP. IPAs are agreements between all key players in the health system, an effort to work together for enhancing performance. It begins right from the Department of Health and Family Welfare down to the district, hospitals and the health centers level. IPAs come with specific indicators aimed to improve management, knowledge and satisfaction among patients. IPA will aim to stimulate good management practices leading to better quality of services. In short, under IPAs, every level has a clear role to play: the state, district and health facilities.
That's interesting, Ms. Pui. But how does IPAs help the health system?
Dr. Victor, IPAs will allow regular performance monitoring and review of facilities and team through scorecards. They will help in institutional strengthening and capacity building through high-dose, low-frequency training, the so-called clinical vignettes. They will strengthen the design, systems and operations of the Mizoram state health insurance schemes by improving beneficiary enrollment, reduce financial burden of health services on poor families, and develop faster claims and dispersal mechanisms.
IPAs are ways to bring some extra money into the system to boost performance and find local solutions. They will be verified both internally as well as by external verification agencies. And Dr. Victor, once they have earned this extra money, they can also reinvest this to further improve the facility.
Okay, so IPAs will set a wheel of change in motion and help travel the road to good healthcare for all.
Yes, it is a step towards revolutionizing Mizoram's healthcare system.
Wow, this was informative. And I like the idea of IPAs and hope you like it too. Friends, please feel free to ask more about IPAs.
There you have it. That was the IPA teaser. And with that, I hope you all have a better idea and knowledge on what an IPA is and how it is going to help in implementing this very significant health initiative. Moving forward, we are going to have back-to-back presentations from two very hardworking and dedicated medical doctors. First, we have Dr. Christina Zonunmoyi. She is the medical officer of Lungsen PHC, and she will be followed by Dr. Nunpui Quality Assurance Team in charge, Lunglei District Hospital. Through their presentations, our doctors will highlight the various achievements as well as challenges and hurdles faced by their respective facilities. But most importantly, they are going to share their plans to overcome such gaps and improvise the quality of their services and achieve national quality assurance standards and course certification with the funds and technical guidance they hope to avail from the MHSSP.
Yeah, good afternoon, everyone. Respected Honorable Health Minister, Government of Mizoram, respected Secretary, Health and Family Welfare Department, respected Project Director, Mission Director as well, MHSSP, and all other distinguished guests and my dear colleagues. I will be sharing in a few minutes the need for strengthening public health facilities and services at the primary health center level. In this regard, my current place of posting at Lungsen PHC will inform the tone of the presentation. Next, please. So as you all know, I'm from Lungsen PHC, I'm posted out there, and we are covering around 13,000 population, and it is located in the western part of Lunglei district. Other than the Mizos, it is an area populated with the Chakma, Bru, Bom, and Pang communities. The above mentioned are minorities in the Mizoram and by and large belong to socio-economically backward groups. The climate is mostly hot and humid and is well known for high rates of malaria infections. Significant number of roads are fair weather, motorable only. Next, please. So some of the challenges generally range from insufficient staff or human resources, need for capacity building for staff, infrastructure renovation, cultural differences, mixed population, communication or language related issues, transport and logistic related issues for health personnel or interior village population as well. Next, please. In my presentation will be broadly divided into 4 areas of focus. 1, institutional related challenges. 2, subcenter related challenges. 3, population related challenges. And lastly, immediate needs for better quality services. So first of all, institutional related challenges. Insufficient or inadequate staffing at the institution level is an enormous problem. I'm sure this is also have been a problem to other institutions as well. So Lungsen, as such, as we said, that we cater around 13,000 population. So the number of OPD cases and emergency cases are relatively high. It is a BDO-based town and has a dedicated police station as well. So frequency of PME, medical legal cases is relatively high, and it is also located in a high infection rate of malaria zone. Next, please. Current strength, we have 3 nurses. An additional nurse could help meet the workload more effectively. As we all know, we don't have pharmacy, so one of the main challenges is one of the staff nurse. We assigned her to take up the medical stores. So especially during the peak malaria season, especially May to September, the single laboratory technician's job of cross-checking malaria slides while catering to regular OPD and emergency demand is a challenge. Next, please. We need also to well equip the laboratory, equipping the laboratory with additional equipments like coagulation machine, shaker, cell counter, calorimeter, etc. Then updating and upskilling of the lab technician as well. Next, please. So at the subcenter level, we have 5 subcenters catering around 13,000 population. So one subcenter is looking after around 2,500 populations. So out of these 5 subcenters, we have only 4 male health workers and 1 female health worker. So ideally, if we can have 2 health workers, like 1 male, 1 female, that will really help, especially for mixed population catering around 13,000 with ANC rate quite high also. And recently, here we have 3 health and wellness officers, thanks to our mission director as well for giving us support staff for strengthening this health system as well. With these 3 health and wellness officers, we are running quite smoothly till now. So only 2 sub-centers have Group D staff. The rest 3 sub-centers does not have Group D staff. Next, please. These are the technical assistance we used to get from the district as well. Since we are running out of staff, the district, with the initiative of our present CMO Aizawl West, Dr. Thani Pachwa, she used to organize this mass blood collection for the PHC. So thanks to Madam, we are still continuing the practice. Yeah. Next, please. And infrastructurally, the poor sub-center buildings need some maintenance. Some sub-center buildings, due to lack of adequate quarters, are used as a residence set up for the health workers. As such, the problems of logistics also arises. So transportation and logistics related issues we are facing. Some of the villages are located in very difficult to reach areas. So especially during the monsoon season, it is very difficult to access by 4-wheel drive. We used to use boats as well. So for us, rainy season is more costlier than the dry season. Next, please. So this is the kind of transportation we used to use. Sometimes during the dry season, we can use the 4-wheel vehicle, but then during the rainy season, we used to use boats. So it is quite a life-threatening for the healthcare providers as well. And next, please. Yeah, these are some pictorial, some pictures. Here we see some adults. These adults are attending the NCD clinic at the PHC. If the medical officer is not able to reach them out, sometimes, since it's a BDO town, sometimes along with their along with other visits as well at the Lungsen, we used to invite them for NCD checkup. And these children, these are the ones who attended the adolescent health clinic. Okay, next slide, please. So in population-related challenges, since we are culturally different from one another, we have different languages as well. So differences in culture due to mixed population of the overall Lungsen PHC creates a number of issues. Health workers at times face challenges in relation to genuinely express the nature of the different communities like Chakmas, Bruce, Pang, Bom, etc. Language-related barriers also impact the quality of the health services delivered. Mostly illiterate population as such, written materials often fail to communicate critical health-related information. So pictorial message is more helpful for bridging the communication gap. Okay, next slide, please. They are largely agricultural-based communities. So they are earning their livelihoods mainly on agricultural farms or jooms. Implementing various programs which require fixed schedules are a challenge. Most of the time they are spending their time at the jooms. So it is really a challenge for us. And due to this, a majority of their time being spent in the joom, which is located in a far-flung, inaccessible areas for the health workers, it is difficult to reach them out. As such, the quantity and quality of programs deliverable is compromised. Okay, next please. See, these are the type of villages that they used to create. They used to stay here in the families. They used to, these are the type of house they have. So it's very difficult for the health workers to reach them out for routine immunization, for antenatal care, etc. Next, please. Floating populations related issues, especially with respect to the Chakma population, there is a floating population related challenge. Besides agricultural related movements, there is a general tendency for them to move out of their village to one another random village for a significant period of time. So regarding the RCH program, covering these pregnant women for full antenatal checkup is really a challenge. And tracking the floating population which may be here today, will be gone tomorrow, is highly difficult for the health workers. This affects the target achievement of the various health programs under National Health Mission. Okay, next please. This is the type of house. This is in a village called Kautswa, which is under Putlungasi subcenter. This is Kautswa village, and this is the type of house they have. So it's sufficient for 1 year, and the next year it will be all gone and they'll build another house. So it's very easy sometimes for them to move here and there. Next please. Impromptu outreach immunization sessions. I'm putting this word because, like I have mentioned earlier, it's very difficult for us to catch hold of them. It's difficult for us to fix a day of the outreach. So if we call up the village chairman, the village chairman, suppose, if he says that there are few pregnant women in the village, so we will pack our bag and then we'll reach them out on that day itself. It's very difficult to fix an outreach session for us. Next, please. So in my last slide, I'm highlighting the immediate needs for better quality services. First of all, we need to improve the basic laboratory equipments. So I'm putting on the need for procurement of basic laboratory equipments. Secondly, like we said, since it's a mixed population, non-Mizo speaking and written communication is really a challenge. So pictorial message helps us a lot for improving the better strengthening of the health services. So for this, the PHC needs an LCD projector, and provision for organizing capacity building trainings for the staff is really a must. We need to polish ourselves every year since we are understaffed. We really need a capacity building training, and installation of power backup, especially solar support, is really needed, and provision for increasing human resources. Like we said, human resources is a challenge in every institution, but for us, if we can at least have one more extra security, PHC has, like in other soft areas, it might be what to say, might not be needed, this hospital security, but for us, as we said that we have a communication barrier, this security, PHC security is really a must, because suppose we have treated the patient, and if that patient is not having a fever anymore, feels like he's already well, recovering from his disease. But then, because of his incomplete treatment, we might ask him to stay for a while. But due to this zooming cultivation, all this problem, they'll tend to leave against our medical advice. So we have so many cases with leaving against medical advice. So for this, we might as well need a security guards. Okay. So then lastly, we need life jackets. Life jackets I put because since they are highly in a riverine settlements, we are in a life-threatening condition. So if the MHSSP can procure for us the life jackets, it will be more helpful for us to for outreach session. Okay, thank you so much. That is my presentation.
Thank you, Dr. Christina Zonomoy, Medical Officer, Lungsen PHC. Next is our second presenter, Dr. Lanun Pui, Quality Assurance Team in Charge, Lungli District Hospital.
Good afternoon, everyone. Respected Honorable Health Minister, respected Secretary, other health dignitaries, and everyone present here. Warm greetings from Civil Hospital Lunglei. Today, I'll be sharing our journey on National Quality Assurance Standards, or otherwise known as NQAS. Even though I'll be speaking from our experience at Civil Hospital Lunglei, I sincerely believe that the content of my talk is a fair representation of the most district-level hospitals in Mizoram. Next, please. Civil Hospital Lunglei hi kumza somnile pakhatlai lau nito Kanshacho angin 160-bedded multi-speciality hospital ni in Southern Mizoram Tana Referral Center poimo tak ania tuna hian NQAS noya 18 standards kan nei zinga hian 16 standards te hi chu a functionala heng zinga kan nei lo chun chu ICU le nutritional rehabilitation center ania hei hi kan ho tu ten min shat sakatuna hian malak me kani hei hi Civil Hospital Lungleya kan team te kan ania tuna hian Ayush doctor te dental surgeon te le program changa kan doctor te zongzong nen doctor somthum le pakhat kan oma hetia han en mei hi chuan kan tam tham ria wa thum khat chu district hospital anga chuan amai ro chu doctor achan ve ai tam hi specialist kan ni awangin mani department te te chho pakhat te in single handed in kan rana chu wang chuan tam deuh anga lang si hian in dai na kha chu om chuan lawani tika ka soidu ni chuan in NQAS story kan kalphu kan journey hi angai no me ma voin ni akan soidu chu 2016 December a khan first sensitization meeting ne ani a chuta chuan khang hun laya medical superintendent khan training atena amai ro chu engtinge ka tyang engkim kha kan ar khothim dai ani chuan 2017 na senior doctor pani te training tura ko an ni a chuta chuan in departmental activities te kan thiam ang khan ma kan han lavea chuan kan first internal assessment na khanin kan score to 56 lek ani a chuan in state quality assurance unit 10 mentoring visit min pe a khang hun lai kha chuan in engkim kha kan she thiam lova engeni keima ni kal khan kan kal ve topa chuan in 2018 aron ni a change of ngeni hospital administration na how to tharte kan han neya kan road map te kan departmental assignments te kha kan han restructure chuan in mandatory committee ang kan nei tur ang zong te kha kan han siam thar le a policy te SOP documentation reporting and recording zong kha on war footing with all possible resources in kan han ti ve ani chuan internal assessment kha kan neya chuta chuan October 2018 na khan kan score kha 68% ania national regional resource center gohoti changin mentoring visit kan neya chu kan hlok pui ma ke mani hospital a po khan QA activities a khan mason na tam tak kan nei pha 2019 na doctor pani training state level training turin tir kan ni le a chumi zo a chuanin how to te du sakna in ke ma hi national assessor ni turin gohoti a training in ka kal le a chuanin training te kan nei zo a mandatory exam te kan clear nu in national level quality assurance assessor tu na hian ke ma hi kan ni meka chuan kan thei ang in NQAS activities te kan han bezela internal assessment July 2019 na kan neya tuta chuan ahma a kan score nyam te si kha 83% ta khan kan han in lang kai chho thea heng hi kan department sang te kan score ania chuan hi area of concern wise kan score ani le a chuan 2020 ya COVID-19 pandemic aron kala chu chuan kan activities zong kha aron ti thwan op tavek maya amai ro chu kan phe ang tok le kan phak ang tok in kan good practices te kha kan continue zela chuan small group training te kan neya ma se heta hian ka share du chu quality assurance ani emo kaya kalp atanga kan thil zir zong kha allow practical lutu ka human resource in dailona ana sa thil dang shim equipments te po kan nei lova recording and reporting kan nei lova ni ma se QA activities kan lo nei na khan kan resource kan limited resource kha chatta ka mangtang kai thei turin min lo pa chati kan sha chu achievement hemi certification te po khan nei lo ma ila keima ani ya chuan he kan hlok puina pakhatani ti kha voin ne han kan share du pokani chuan November 2020 ya internal assessment kan nei la he 86 score ani heta kan hu ang hianin ama nen khan dang lam na vak a om lova next please next chuan in 2020 chang hi som hi pakhata chuan kan thei chu kan soi ang khang kan thei ang tok tokin ka zoite te in tip te ang pandemic ka rak ma kan han la zela chuan state level assessment kha February thla in kan neya chuta chuan kan score to 76% alo ni ta chuta chuan NQAS engani national level certification turin tu na han kan in bot sai me kani kan jin kong chu tia ang chu ni a ha thla ka mishing kan in dai lova engani engting ka ting heta ka slide ta ka da ang hianin it's very exhausting mase a hlo na tam tak kan hu ani pakhat na chuanin damdo ina son kan ho tu te chon an che chang e me manga I ma son na tam tak kan mu a chu chu kan hlotlin na pakhat chu ni a pani na chuanin I dam lo min ron pan tu te kan beneficiary ten an chan turang an chan pol turang kha thil tam tak ama kan ti theilo chin kha an hu thei to ni ti kha kan sheboka tin lom om le me chu staff te zinga tho ho na cha a positive behavior kha en QA activities khan staff te zinga atu a tho ho na cha tin ama te chuan thil tam tak kha phun noi na le engeni complaints kha tam china chumi om lo ti kha ama ero chu QA activities kan hangkal pui chuan kan nei ang te hi trangkai takle engen thiam taka kan man chon dam lo te tan khana trangkai the em mani ti kha kan han che chuak ta ani chuanin kumli chung khang kan score kha khati khana ron sang thei boka chon ho tu te abik takin state level support kan nei na sa a Dr. Chwano male team te kan han ti bi kanga an ma ni hen engki ma QA activity shima te kaya kalpa te min tran puina sa ma chuanin hospital all staff hemi involvement na hi ama kha chuanin so civil hospital lunglei chu kan soi angin kan tam ve du athil ti har sa china hospital te anga loko ro in hatlang angu han ti at kan tho thei mai chinang kha in motivate har sa ani amai ro chu heng ang kan activities te hianin kan thok tu te kan nurse te le dang staff dang zong zinga hianin positive attitude positive behavior atu ani ti kan sha kan lom boka tin khang ang guidelines kan nei te khan ke mani hi kan han chau deu don kan han ti pe lo deu don pon min ti phur chin ani ti kha kan sha kan hlo na kha kan han share boka ni next problems hindrance soi don chuan soi tura tamanga kan ho tu te hate for inia pon oma acha chang ber tu te an nia ma te po min lak sak kan lo me ma issue shang oma achente chu facility level la ke ni na kan lo chin fel ve mai tu te achente chu policy matters how to sang zo kina min ti sak ngai te po oma chu tiangin sumlam har sat na te po kan sheve kanga tin ato bera chon human resource issues hi chu englai po kan in dai lo na akhani avo in local khom te zinga chuan stress vak kha katum lova next please enge QA in quality assurance hian enge atum kan ti chuan achieve sustain and progress ani target kan setang tu target achieve tu chang kan thei patopin kan beanga tu target chu kan achieve me thei ani amai ro chu engtin nge kha kan thlotlin akhang kan omreng theng engtin nge kan sustain ang kha chu tlemina doubtful deu heka tu kan thlotlin na chu kan sustain renga nga malam kan pan turani progress kan nei turani amai ro chu progress nei tur chuanin enge kan ti ngai ti kha ilo endonila hey our expectations the road ahead hey quality assurance chuan the three pillars anti lungthu pathum outcome progress le structure ti hi omani outcome kan ti chuan results anti non bed occupancy rate ti te referral rate ti te dead rate sang kha omta chuan process chuan how we do the procedure mo anti non dam lo kan endante dam lovin an engani an chanvo turan dong cha MT te biomedical waste engtin nge kan manage ti te kha process chuan om ta to anoi ber a structure chuan I buildings ti te equipments ti te human resource te kha om ta ni kan training na means shil fochin chu kan building te kha chu lo thalovin lo hlui po ni se hetilai a process la ya hian thatta ka kan ti chuan NQAS certification hi kan nei the ni ti hi kan in zir tir na ania next slide please kan thei ang tok chuan outcome le process hi chuan ke mani phak tok anga chuan civil hospital lung le kan pharve ni in kan sha amai ro chu kan gap kan identify lai chu structural process kan problem hi ni chumi omza chu process le outcome kan tin mark enge kan ma kan son theina chu chuan kan structural gap hi kan identify kan close angai bok ani next please structure kan ti chuan building sanyanga human resource te po omanga equipments le materials te heng zong hi sum tam tak involve ani tin ba ka ke ma ni na kan mason na turata na kan chan mo bo kan nia fundings kan sha kan har sat na berania vo in nia hand kan han stress do tu we have come thus far with our limited resources and are unlikely to progress nor consolidate our achievements without further funding ti hinia atsan to all activities are outside budgetary sanctions. Training requires funds and infrastructure improvement and maintenance requires lots of funds. Example han kan side do kan mortuary department kan morgue so atira chuan kan score ka 42% lekha ni atu na hian 66 a kan eng lovani so mi so eng ang po in masonin so milaya so han improve tum ma ila atheilo na chan chu structural gap a structure laya khan antinan deep freezer kan nei lova walk-in refrigerator te kan nei lova 24/7 power supply te om theilova embalming ti te ngaya khang anga kha ati laya khan ti thamai la structural gap akha kan close tel lawa kha chuan har sat na kha kan nei ta so te ang chuan department tam tak te po har sat na kha kan neya antinan buildings te toilet furniture equipments le other this engeni zongjong thil shim ma hi a that tok lawa wangin local improvisation ti renga ngaya chu chuan dam lo te hne na healthcare kan pek tur ang kan pe thathei lo thin ni antinan kan hospital building chu kan ho tu te chuan an sha anga achung te a fareng ta chu ang kha ang te toilet te po chheneu neu te lo om ta 4th grade in dai lo na alo oma tu ta chuan khang ang an ti box si kha chuan dam lo kha achang chuan kan ngai to theilova tin 4th grade in dai lo na awangin medicine male female wat te le wat dang zong te 4th grade pakhatina a op angeni a kop chang kha lo oma chu wang chuan kha ang problem te kha kan nei boka chuanin computerization hi kan engeni kan priority kan project lian berve pakhatan nia chan chu damlo kan tama thok tu kan in dai lo na wangin heng ang automation te hi chu nei theilang chuanin ma kan son ko pangti te kha kan han soitel du a equipments and accessories te po mamo tam tak kan ne kan ho tu ten min pezela chu ti rol chuanin mamo dang kha ala om zela hey example me pakhat ka han soile du chu doctor kha kan om no dani khang khanin casualty call kan laboka chuanin specialist pakhat an lo ni a ward round na nga ya chuanin ward round zo OPD ka langa ya khamini kha a casualty duty te alo ni boxi chon MLC case te lo om ta ni chu ta chuanin dam lo ena OPD ya khan a thuthun kha atlai ta thin lu tuka buar puya tangten jing ka ra an ron kala an OPD khamini nang man tur lang man ngei tur khan an ron thlenga ti khan doctor kha kanin dai lo wangin khami big department na doctor pakhat cha specialist se omwan alo chutlai ta a chuan chuta a doctor pakhat chutlai me khan alo effect lawa laboratory lama te hall te kan nei tam lova big taking kema department big ka biochemistry department na cham automated analyzer te kan lo nei lawa engkim manual ani wahan test hun chung ro rea chon doctor khandar som pania po khan en set as aron thleng chho sample kha lapa aron thlen kha chon dar khat le chan ve te lo ni ati nong song ne ti khan doctor ka an mu le man lo chin ta kha ang me ho engeni dam lo te khanin all sam takani khat chunga an healthcare engeni service an don theya kha hun taka an dong thei lovani soi tura tamlu tuk the list is endless poimo bernia kan sha chu commitment and consistency hi ni as in general hian mizo te hian professionalism hi kan la chama abik takin anwai kan ngeni an lal lo tel tila kan ngai poimo lo tel telemonity mai turania chuanin chu mi ba ka chuan kan staff te training te kan han pechina sarkar atangin program tharte an han lauta launching program om zo thei pato pin phurna nen kan han tia achang chuan provision kha om le thin si lova engeni chhuat no dan ti te tyang thil chang kan han zir tira an man ro kha kan pele thei thin si lova achang chuan khang te khan ati no latin abi takin group di staff pe hi tu ti phur te hin ngai ve china khang te anga khanin hei funding kan nei thea khang te ang staff mobilization atana poisa te kan don thei chona tangkai le zwale mem don ani kan problem kan hospital chau poni ka ring lo biomedical waste management program hi chu Mizoram pum puya ani in ka ringa next please problem new minor hey collection and segregation te po omta collection na chon color coded bins kan data achina chon wa ta te phei chon wat dam lo nga de wa chon alo chia tin lung le ya te phei chon color khami color code te kha lo om lawa bolho bom a eng ni na te kha adum hei hi bolho bom du mania dum pai tur ti te kha tar ngai chang te kha om china eng po chu ni sela chu minor problem ania kan han segregate China heta hian heta troi thei lo bai medical infectious waste in kan han tive a to pa chon a disposal a bok khang kan boy le engeni bollo dumping ground a hang kan chung thale rui tho China ni chu wang chon he hi angai poimo om ka ti emema human resource te khate ang kha chu kan sha to sa ania next please kan hospital ho shim han liquid waste management plan aizo civil hospital te chuan thatak in an neya district danga hi chuan khatia anga tha kha chu kan nei cha lovin ka sha tin shredder se tin kan incinerator po so lian pui mai kan neya ma se a chejing me ma asang box ya achung te tla china chu wan chuan in tin incinerator hi ate angeni kan hospital mil ani lo chun a lian lu tuka it needs require engeni constant repair angai china poisa the cost of operation po a high boka chu te ang next please. And finally, enge kan ma hian what lies ahead, further progress. Chu kan mason na tur chu kan consolidate ang chu ta chon NQA certification chu kan nei thei chawang ti na ni a that can only be achieved and sustained with additional resource allocation and mobilization from all possible sources. And yes, we have progressed from where we were. We know our goals. We are aware of our deficiencies. We have our action plans. We do hope to improve further, and additional funding will get us there. Next, please. And finally, this is my message to World Bank team. Next, please. And yes, an entrepreneur without funding is a musician without an instrument. Thank you.
Thank you, Dr. Nunpui. Our doctors have given a very resourceful presentation, and areas where health facilities are lagging behind were also well presented. Hopefully, with the launch of MHSSP, the many challenges and issues will be met over the next 5 years. Next, I would like to invite one of our senior doctors, Dr. Limpuya, Chief Medical Officer, Kolosip District, to share his and his team's future plans to implement the MHSS project in transforming the health system at the district and block level.
Good afternoon, everyone. Honorable Health Ministerial Chief Guest, respected Health Secretary, Chairman, the directors, le kathok kui zong zong te. When Chanua Kolosip District I was tut toy so na hun kan hi ka lom le maya. Hey when ni til thar kan zir tan na bul alonia. Mizoram Health Systems kan project ki Tilthar ania Chumi atan masatu district Kolosip than kan ni hi lomum ka ti le maya kan ho tu te chunga po lom thu kan soya chuan he project hi Kolosip tang azo karon kal theng khan ke ma hi ka welfare lo tuk ta ka bang bo lu tuk ta ni amero chu kan mission director in overview presentation aron ti kan ngai thla ka tang khan ka chiang tan ve chawa khami kan ngai thla kha a comforting and challenging ka ti khop maya kha khan district level na min thok turin min tur lui dona plan siam turin min tur lui dona execute turin min tur lui dona chu chuan health system kha a quality kha aron ti thadon ni a ka se da wang khan kariru hi ahlim hle maya hemi chung changa hemi urban supported to angen IPA kan ti khami akal ko dan vela ti kha zir tham oma chuwa chuan presentation tang kariru lo lu ta chu a comforting a challenging mai pia lama khan performance and plan execution based incentive angin nakaling ka sedewa chu I athat na turpo alaw ni ta a he project remchang an latayla atana sutu kan health minister za takle kan mission director te inpeg na te an na thozar wena kan zohi alomum katitak zatani hei hian na satakin health system maso na minpeg kabe seitlatani kan setewa kan tun din huna chun enge kan ti ma atang to avoid ni tha kan na ti chu preventive le curative measures kha kan ti จับไม่นี่จุดจวนนี้ national program สังละโอมานูนาวไปไล่จังกันเอ็นกุลานาวเตลูเปียงกันเอ็นกุลาอาลูเซียนเดียว school health อาลูเตโรลา adolescent health จุดdisease program สัง malaria TB HIV non communicable disease ที่จงอินกันหันตัวมชัวจวนประเทศของไอ้นาซาระกันเราเอ็นโกฟิเซลเขาก็อันเราตัดตาตัดโปรแกรม elderly programming กันหันตัวมเละจุดอย่างเรื่องนั้นกันติชิงการะชวนตากบอลนัดตากช้ำนัดตั้มตักกันนี่อาการเสพกาขัดอย่างกันตากบอลนั่นแหละกันหาสนักกันตากช้ำนัดจงที่นี่เสียงชวนโอ้กันติวงชินักฮะเฮมิโซรัมเฮลท์ซิสเต็มซึ่งในโปรเจกต์เขียนอารมณ์สุขยังที่โดนนักเสียดนักกันนี่วังเฮียนก็เรียนรู้เรื่องไม่มันนี่กันเสียรังคานี่กันหาสนักเรียนเปิดจะซุ่มเละไปเนี่ยซุ่มเละไปโลชวนดวงอินหาโถที่เราตีกันเจียงเดินอินฟราสตรักเจอร์กันตลับบอลนัสลุตุกเตโลจิสติกซัพพลายกันคำขบโลลุตุกเตดินมันโปรกันอินไดโลลุตุกเตอดังปวดตะมังขัดยังทรงตะกะเฮโปรเจกต์ที่อัตตะกะกันหันติจันหุนาจวนสุดเกียนะอมโดนวางเฮียนกระรือมิตรท่าเฮียนเขาเองอรุณหลังตักเมียจุจวนมินติลิมทรีนอินติกังเอกันจันเทียงกะเทียกับเป็นส่วนมาเห็นจันมันนี่ละสัญญาหมดเจ้ากันนี่โตเสียกะเทียกระรือเฮลมันมือเอ็มเมียจวนกันโลวิชนาจวนอินเฮโปรเจกต์เฮียน to reach the unreached to help the poorest of the poor ติค่ะอรุณกิ้งติลดูนักเสียดนักติกันเนี่ยจู่ว่าจวนตูนมากันว่าเทนง่ายเรารำติกันเราเทงถี่ตัวงะกันเทนพังง่ายเรารำกันเทนไม่บ้ากะทิ้งจ้างไม่ได้ทิ้งจกเตนะ health system โอซัมตะกะอันบันพักกันหันฉกน้อยตูตะกะกันมิถาอังหาเลลมกะตีอารูปุยโปกะตียจู่ว่าจวนเฮMizoram Health System เช่นนั้นโปรเจกต์ที่ไม่ได้ที่จะเช่นภาคคือเสียงนักจันจินชาโลนิมตุรินวันนี้ยันดูสักนักสร้างบริการหลานนี้เอกโลมิ
Thank you, Dr. Limpuya, CMO, Kolasib District. The MHSSP is very fortunate to have such a strong and solid support in the Mizoram government right from the start. In fact, the project's steering committee has the Chief Secretary as its chairman. Our respected Chief Secretary Pula Lunmoy Tsuaungo was supposed to be here with us, but unfortunately he could not make it due to prior official commitments. So with that said, we will move on to the much-awaited event, that is the official launching of Mizoram Health System Strengthening Project. I humbly request our respected chief guest to address the audience and also do the honors of launching our new project and release the e-newsletter.
Kan in lat thau hi nimina kan negative airport tukina kan negative la alom long suma tuam thamero o kan lai ber poi meter insang ni o meter som do nai tra yes mizo trong ka soi ma sa lok te launching kha to lam pa ti te la sap trong time engeng mothil ha soi tur kan ei du leka a to lam panga te min engeng mo state bit chi in sap trong in ka ti do ne o alo mo mai kan health secretary te kan pd kan project director hebi encol tu te tin kan director te bi poi mo tak tak te tin kan som big te in sawain chi bai kan book chawa nibin tlaya deleting karon theng ve tur chum chu record ka breaking ka ria monday ka kal kha atuk jingdar soma ka thana ni pum hlom ka ne ya mun som pasari meeting ka nei mana sang a ko som ko pariat sang ni le pariat ingkar kum som chung khan ka ngai to le thina ni khat chung meeting pakwa te han ka far a har khopak tingai lo wa tun tu ro chu cho e da hun kha mang lo wa minute som che
cho này dốc nó hun mà thang số cái skip đều bọc à tiếng chuan hun cần mang à alo mong khó ta chuan report tối te kan pek du lok chu ne hey repent si kan te dei tang voina health department nuai thoban ni a tin chu ti lai chuan in trom institution ani a song ni le pakwa February thato pa vai bel che zali som riat lai mai sanction ti mela phal na mo ni a ma se kal muang em maya tu tuma kan health minister thar woman suka tenen kan han soi howa an joint director thalo de mai an lo nei khan bin opril tu kha har sat na liat tak ni ka tu na chuan mei chia a fel tu ra ngai telan nei thara nakal lol lova apoi khop maya human resource professor post te le tilang tam tak zale somga le palilak tu rom te tin aniam lampang na lak tu rom zong song te a khai lakri ta le maya aza thla khop maya tin chu bi pelama chuan infrastructure boys like girl hostel ti te doctor quarter te staff quarter ti te auditorium ti te a thil tam tak a hospital administrative building kan han tiang chi te po king krere kha akal theilowa chung te ju kan juk soya chuan panida chuan voinia kan thil launching island. It will be much more bigger than today launching in terms of poisa chuan and dona. Chu JICA funding kan tia Japan International Funding Agency tenera kan in biak rem thui tak akal to a chu voine hian kan hlo ting don ta hi along ka tia zemobok tlang ason kan CMS office te kan an sondor pha dona solai tlang bok ason in cancer Mizoram State Cancer Super Specialty Hospital nuai singa lian tangani soizong pun ngani dang ok lek lek kan tam lu to ka nuai singa project kan than thei don ta kalom khop maya ei aboy pui tu te doctor mangai ten oma doctor zeria te ho abik takin anni hianin technical appraisal thil engkim boy puin an boya tuna hian kan final ve thei don ta kalom khop maya chu alien hle dona India marsaka it may be the best in Northeast as apuyom long international standard super cancer specialty hospital tura kan ngai chu tun thuma kan ju confirm ta kalom khop maya chuan kan covid scenario hi toy te in PowerPoint pe kan tuma amaro soren chi alova chu kan hin fia thi state dang tenan kan ngai to kan claim hi an comment poimo tak mai kan ministry ten ani ti kan soidwa ten mithil phal tak kan nei Indian Council of Medical Research and how to barber Prime Minister point voi doi lo ako thin Professor Dr. Balrama Director General ICMR hi kan zup muwa office akan pana aza thak lik kan lut tur kha ka thalak lian tok nen ti khan min lo welcome a ro pu hi ka tiang reng khop ma India ro chen lol berani anin he da tang hian ZMC we are there left so jin kan mu khan ya mo thonin chu mai ni lovin a thok tu turs panga a thonin kum thum chung minan phal saka chu ba ka kan mu to zong hi RT-PCR test kit te RNA extraction test kit kan ti te chi sang hi avain kan han bel pot then vai bel som ni du tho ting to ni state dang nan pulo chu bang chuan lom thu soi angaya lom thu ka juk soya na kum april a hian ICMR kom don to lova lal takin All India Institute of Medical Sciences chief of cardiology department kom don ati chu lo khre lokola khalam pangdat nei tan chuan in mel khia ta thakop mai ka juk mel khia kep chu o adang le chuan kan soile du lok chu Union Minister ringot hi kamputa me ka soidu du lovanga kamu na pakhata chuan Union Minister for Tribal Affairs ani hey Dr. Tluang hi ka ruai sok tun ka hia avoi khat chu kha ka han mu chulaya thil soi poimo ta chu tu na hian article 275 mang hian PHCC saknan te sub center saknan te eng mo noi te hi kan mu ve na noi lu tu ka PHCC saknan noi sari ti te so angai dam lo thim kan nom san lo thim ma OPC te sub center PHCC saknan noi somnga po kan nom san ni lo crore thum te langai to chu wang chuan tun chum chu i thil phal ta sa alian chin kan o siam don PHCC ya kan mo zong song mo then khat chu na birth in min ti saka kan mo thil dang kwa sar nen lam tam tham de ulek ron ti kan tuma sub center tenen kan hatia primary health care ya pui mo tat maya he ta hospital lam chu kong dang ni sela chu comprehensive DPR a ran pa liu hin kha kan siam dona chu na ka ron tuk de wan chu ni ti kha kan soi du ni kha tuna presentation kan nei thla ka tanga thil chiang tak chu ti tu rawa tam em te ni chu bang chuan kan hospital lampang apo hian na se taka chan lak angai ni ti kan ria a hemi chung chang hena big takin ni ti a yok kan tia tun man planning commission an ti thin kha tuna chuan ni ti a yok alo ni ta a chu ta an member secretary an member poimo tak mai aim sa pediatric department a head of department Dr. Mangai ta po lo zirtir thin tu Dr. Vinod po la kha tun tu chu kan zukin mule a kanin kong nge voi tam takin mu to kan ni a tun tum chu itse tangai Mizoram tan kati a rei tak kanin koma tun tuma a lo mom khop maya kan hospital zong a bikin zet MCT amin kan mamo hil hlom khat fel tuin kan on tianga ate don lo katia ron ti fat chuan tia vain ti va don ti chuan an ti don aniang a te chu ka ti dewa chu na hau tak aniang ba se he kan take up thei chuan he ta tribal affairs lampanga engeni PC le sub center kan ti te kan community health center lampang te kan kalanga niti ayok lampanga khati zong han kal te la ti kha karil ro om de uleka kha kan serau du ve chu ani heng ba kai chuan ayus Ministerial thil phal don hle maya district zonga ayus hospital sak puchung min phal sak don ang khop maya ma se sak kha amuang le ang mo ka thi le a har sang ran khopa to na patient the quantum of assistance kha allocation kha atamang rega crore som panga ni loi don di kha secretary min rela ten chuba ka chuan tun tuma COVID-19 kan do na ko nga hian kan ngani vet ayus doctor ten chang ema nakit aloi han om mang si lawa eng tinamo heng CSS scheme nuaya kan dang chi tol hianin kan doctor engam musa thichu na hulo himin lak sakula thang ka tia chu min pek thei tur thu commitment ang reng de ulek bin sila kalom khop maya somni somma travel chu kan mu thei mai thei ayus mi kan lo kalem mo kalem mo du sak den lo khil ru o chu lo chu ne union minister HRD ti te kan han mu no ko nga chuan MZU southern campus ni kum hasa USA tang kan lo hoi na kan ron ti fel tak COVID awang buang sang lutuk rang takati an tum thu te ten rusa kan te assistant professor som sari lepani e ka hun la hian kan han munol maya lo la loin rei tak an lo oma kulaya athok tu ten lo in thak boinen ten tlebin guideline la han ti dang lam nen khang te kha kan han boi pui bokani a ka soi se lo mayang chuan American embassy hun thada mai kan neya nibin pi azing khan dar som le chan ve meeting tur kan tian ambassador te nei khan delhi atuen lian tak maya Mizoram house atanga anom na thleng tur khan minute nga bak tlan ngai mi alo kha minute som thum panga vel kan manga kar sunga khan tui kha ke re kheng zet kha arun chi ma angai la khom lo re re a amaro chuang tin mo kan thleng thei ta rama chuda chuan abik takin USA kan han kal tuma amin boy pui tu Dr. Peter healthcare lampanga USA embassy kulaya ami poimo tak mai khan min lo welcome thil tam tak ta hianin ti tur kan la dei doning ka ring dewa te mo covid te kiam lam pan suwan har sat na lutuk om lovin thil min ti sak le thei tur khi om don te poin kan thedeu le kani ti kha kan soi lo kani chu thil pakhat lok kan soi du chu engwang ani tia kanin ko kho ma kan boi em na chan hin ni berle tia zo na chan na chu kan khisel lo ni adikem kan na thina hospital te PHC te sub center te clinic te kan dil thina doctor po hi win again thu maya health worker te nurse te lab technician te kan om na chan ni ber tia lang su kan dam lo thin wang ani adikem dik che na nge damil chu na ngai lo tru lung lei ya presentation ron petu ron pek po kha damil chu na ngai fak lo tro kan lo dam lo khang lan wang he nya covid te po hi pulim pui tro dam that vari la chuanin Colosseum hospital saktu na sit noi kan ti tur po angai vak lo atro kan dam lo tla ta wang khan angai tani chu wang chon dam that apoi moni health in atar ke dai chu nun na chan ani apoi mo em mai ni department dang thok tu dang zong zong a hian apoi mo filler lakani ti ka stress le do ni apoi mo tlat eng wang nge ni le he ta health ni lo zong in soi te la department dang ba chau kan soinga police department hi om na chan berle ka ti chuan thu boy la boy om thini eng wang e zel om zela da tlak qualify tan lo om wang ani thaviau vekela chuan zeli sak ngai karing me lo zel warden ti te zel weather ti angai do no mon o te ka tia angai karing lo puchung te ro om na chada chu khatia nga om ngai khan om tani tiang bok sang kan dam lo te om na turatan hospital tha kan ma bo PHC tha kan ma bo sub center tha kan ma bo doctor tha nurse tha thok tu tha kan ma mo ta ani chu wang chuan voi ne hian tan la ka nga ya du chen chen dam thei lo lai hi a boi thak lai takania le nga la thi huna oma eng ti ka mo chuan thi thei tamya lo hi la ka thia ma sen ma da kapu kanu pa te kapa te khaladam sela a boy chi boy thak o mo te ina kan ling lo mo nia boy thak viong ngom le o pi se pui te ro kan in no kho mangan tar do sia ru rel na da cho manga nga thok thei bok si lo wa chu wang sa pathian ro rel dan mak tak chu eng tik nia mo chuan kan nun na hian top chin an dei don a hun te a hian ka to pe ti chu tu ma chuan a soi thei lova hun te kan nun na to phun tur bit khia thei tu ma khanom lova ma se kanom na hun khia te ro chu ani lo ni the chianga sumi en kol tu nun na lutak vong tu a guardian chu win hian health department kan ni ti kan khia thar le poi mo leng ka ria chu opening angin toy teng ka soi du ni min ngai thla tu hi rampon na tang tian erikan omang em an om veang mo okay I'll speak in English okay I make a very brief statement it will not take much time well this dear distinguished guest and ladies and gentlemen I'm delighted to be here with you today to speak at the launch of the Mizoram Health System Strengthening Project supported by the World Bank. You know, this is indeed a very, very valuable occasion for us to build a better health system which can serve all our citizens of the state of Mizoram. Our government is committed to provide quality health care to each individual or family or communities. The government is moving with urgency to change the health landscape in our state. This government has ambitious and unprecedented targets, and would not compromise on health of our citizens. Today's launching ceremony marks the culmination of two like-minded visions coalescing around the needs to focus the health of my state. The vision of the state government and the helping hands of the World Bank. I still remember about a year ago that I had the chance to meet the country director, Mr. Junaid. Am I right? Adikem? Junaid. Oh, okay. And, and other officials. And after that also I dropped in for the second time to the World Bank office at New Delhi. So I spoke with them at length on how the time is ripe for the state of Mizoram to take the next, leap in transforming its health infrastructure and its human resources. I was convinced that without improving the quality of healthcare services, it will be a daunting task for us serving the needy and the poor. The current status of either the health infrastructure or human resources shouts out for care, improvisation, and upliftment. I also had a visit, to their, the World Bank country headquarters office at Washington of America to pursue with their higher official, I wanted to ensure that we lost no time in fulfilling the bank's requirements for health system standardizing project to be initiated in the state. I got our own state official also geared up for this purpose. Not many of you may not aware, but the fact is that the relentless pursuit and unprecedented support of our health officials today, we are able to live, this very, very important moment today. I'm sure you would agree that both health and happiness are to be pursued diligently. I would like to extend my gratitude and warm wishes to this particular team. And at the same time, we have made good progress in terms of health indicators, but long way, as you have just heard, to go. This august gathering of like-minded people who are committed to improve the health of each citizen provides an appropriate occasion for us to reflect on the achievements made by Mizoram State in the last few years. As per the health index report of Niti Aayog published in June 2019, Mizoram ranked first in overall performance among the smallest states in the country. We have made tremendous improvements in maternal and child survival under reproductive, maternal, newborn, child, and adolescent health strategy to improve the quality of care for the poor. We have ensured that the children under 5 years mortality in Mizoram is at 46 per 1,000 live births, when compared with 15 nationally, and similarly, the prevalence of stunting among under 5 children was 28.1% compared to the national average of 38.4%. There are significant rural-urban disparities in Mizoram, and we need to ensure that our citizens in villages also have access to quality health care. But at the same time, as we have just heard, raising of cancer cases are cause of concern. This is really, really important. But it is very, very unfortunate to, highlight. As we all aware, our state is facing an acute crisis of non-communicable disease. These NCDs account for more than 50% of the disease burden in the state. And it is no pleasure to learn that Mizoram suffers from the highest prevalence of cancer in the country. Since 1980s, cancer has remained a cause of concern in Mizoram. We know, however, that a healthy lifestyle, can reduce the incidence of cancer, and early detection is the key to effective treatment. Cancer education with focus on prevention and early detection is crucial in our efforts to combat the disease. And I request MHSSP also to take necessary steps to help mitigate cancer cases in our state. You may be aware of my interests in the arena of sports, The players need to have long-drawn plans for marathons. This Mizoram Healthcare System Standing Project is one such 5 years long project, and we have long-term vision of the state for improving health infrastructure. We have seen in Dr. Eric's presentation that the project is a complicated one, but sophisticated machinery. It is wheeled within a wheel. Better coordination is the key. A very, very important statement is. Every directorate, every department, every facility, and I would say every official, irrespective of where we are in our state, you have to complete your task, which will make the small wheel move, and which is in turn moves the larger wheels. This is really important. The success of this project will not only change the landscape, of northeastern state, but also demonstrate our commitment to seal long partnership with the World Bank. IPAS are the heart and soul of the project. This is important. The internal performance agreements are the heart and the soul of this MHSSP project. As I understand, the component 1 is dedicated to strengthen, the management and accountability of various facilities through internal performance agreements. There will be internal performance agreements between the Department of Health and Family Welfare and its subsidiaries at state, district, and sub-district level. The IPS will help create the spirit of more accountable government, contributing to improvements in management of the system and delivery of quality of health services. At the health facility level, IPS will provide flexible resources Strengthening management autonomy, the local health facility board will now equip to take quick decisions for effective service delivery. A primary health center will submit a plan for improvements. Resources will be allocated accordingly through the project. Internal and external verification teams will check the quality of works. Patient satisfaction, will also be measured carefully. If the PHC has done well for a quarter, they can make better plan for the next quarter again. There is a provision. This will be as per the IPHC guidelines set by the Government of India. We will see improvisation in planning, budgeting, and coordination, user experience of patient, incremental improvement in care quality, knowledge and competency of providers through clinical vignettes of low dose, high frequency training to all medical personnel. This is really important. In addition, the capacity building vehicle will consist of champions from health department at various levels who will play key role in internal assessment of results and providing mentoring support. The bank and state will jointly identify local institutions to provide exclusive technical assistance for capacity building that will be retained in the state beyond the project duration. I'm quite optimistic that the IPAS will transform health facilities, both in terms of greater autonomy and also delegating authority to effectively quality healthcare service delivery. Among all other aspects, one thing noteworthy is the initiative for the F newsletter, Dawn of Good Health. The aim here is to sensitize the community on the project activities and will play a crucial role in highlighting the progress as the project initiates in strengthening the healthcare system, innovative steps in countering non-communicable disease, promoting health insurance scheme, and improving medical infrastructure which will ensure quality health care for all would be readily followed through by the general population through this initiative. I'm going to end it. Change management is the new mantra. Now I would like to inform all of you that these processes are new and innovative. We are not used to such processes. Our modus operandi was what we have been doing since last so many years. Change management is the new mantra. If we do not adapt our working style to the requirements of the project, then we will not be able to meet the desired level of providing quality of health care. Finally, I would like to express my special gratitude to the Secretary, Health and Family Welfare Department, Director, health officials, and all medical staff for their outstanding achievement over the past many, many years. With the joint efforts of all of you, Mizoram is not only going to be a prosperous state, but also a place of caring for the less unfortunate, bringing consolation and new hopes to poor and needy patients and their beloved one. May the Almighty God bless MHSSP project and the people in making this endeavor a success. With these few words, and short statement, I now officially launch the Mizoram Health System Strengthening Project for the greater benefit of the needy and particularly for the people of Mizoram. Thank you. Hey, may hin mo.
Thank you, Dr. Arlal Thangliana, respected Chief Guest, Honorable Minister, Health and Family Welfare Department, Government of Mizoram. Your personal commitment and efforts in bringing the MHSSP to life is highly appreciated and will not be forgotten. Thank you again, sir. With that, the Mizoram Health System Strengthening Project is now officially launched, and I now invite Dr. Nuntluangi, Deputy Project Director, MHSSP, to convey the vote of thanks and close the program.
So I think it is my good fortune that I get to do this most pleasurable of all activities, giving thanks. So I will keep it short because we have all been sitting here for more than 2 hours listening to different kind of speeches and exhortations. So first of all, I would like to thank the Almighty God for leading us this far. It has been a journey that has been sort of exhaustive, full of hopes and aspirations, but at the same time also quite fearful at times. So I would like to thank His guidance to all of us. And I would first of all, I would like to express my gratitude to the Honorable Chief Minister of Mizoram, who has given a lot of political support to the project, and he has in many ways continued to exert his support in the sense that it has become successful from the state's point of view as well. I would like to thank the Honorable Health Minister. I think we've all heard from various speeches how important he has been to the project. I think that is also not correct in the sense that I would say this is his initiative. He was the first person to approach the World Bank for a project that would comprehensively address the issues and problems that we are facing in the state. So we are thankful to him for his vision of seeing the entire health system of Mizoram strengthened through a project. But at the same time, as you must have gathered from what he reported from his visit to Delhi, it is also clear that he has still, he is still looking for ways to continue to support the health system, notwithstanding what we're going to do through this project, but also just to continue, to make provisions for the different requirements of the state, and not including from the other systems of medicine. I would like to thank the Chief Secretary of Mizoram in absentia. He could not make it today. He is the chairman of the State Project Steering Committee for the project. He has provided valuable guidance to the project, and we have had several meetings with him in which he has provided a lot of support in terms of leadership towards steering the project. And I would also like to thank at the same time all the secretaries and commissioners who are part of the project steering committee as well. I would like to thank the thank the Secretary, Health and Family Welfare of Mizoram for his guidance and leadership. We've had several project executive committees with him, of which he is the chairman, and he has, as a seasoned administrator, he has really provided the kind of leadership that we need for the project, because this is a project that is very technical in terms of the requirements of the World Bank, the regulations. But at the same time, we also have to make sure that the project, is implemented in tandem with what the state requires, and this is the kind of leadership that we need, and he has been very forthcoming in that. And we'd also like to thank the World Bank team, task team led by Amit ji. I would say without the bank task team supporting us, we would not have reached where we are today. It is the kind of sort of miracles that they've pulled for us. I mean, I think it's hard for me to put my head around it, because I understand all the requirements of the bank that they have made possible for us. And I would like to thank Ms. Trina Huck, who is the practice manager in Washington, who has provided us with the support that we need all this time. And from the World Bank side, not to forget the country director, Mr. Junaid Kamal Ahmed, who has been a guiding force for us, who has very kindly agreed to fund our project. And I would also like to thank at this time all the state support that we have received through our principal director, through our director of health services, through the director of hospital and medical education, not to forget our mission director, who is also now the project director, and also the various heads of district hospitals and also the district CMOs, who have been very helpful during the project preparation period when we were gathering information. I understand sometimes it was very, it must have felt very bothersome for them, but they were very helpful to us. They have provided all the information promptly. And also, I would like to thank at this time, because the project had to go through a long period of project preparation before we got to the negotiations. There were a lot of requirements that had to be fulfilled, and we required a lot of support from state officials, such as from the Mizoram State Healthcare Society, because they are the nodal agency for all health insurance schemes in the state. We have also bothered a lot of people from a lot of state nodal officers from National Health Mission, like Dr. Ardal Swanoma, Dr. Mary, and others, who continue to provide unrelenting support. And I would also like to thank all the consultancies who are with us, IQVIA, Sutra, and also Lushai Engineers, who have contributed tremendously towards bringing us this far. And also, not to forget, we also have the procure commitment committees, without whose support we would not have gotten this far. So the members from the Finance and Law and Judicial Department, who have contributed through their time, through their expertise, we want to thank them profusely at this time. And also, I would like to thank, especially by name, Dr. Christina Zonunmoi, who is the medical officer of Lung Sen PHC, Dr. Lan Nun Pui, QA team from Lung Lei District Hospital, and also Dr. Lal Himpuya, the CMO of Kolasib District, who very kindly, come all the way from Kolasib. We understand how busy Kolasib it is at time, but he gave a very succinct and a very informative speech, and we thank them for their support. So I would also like to thank the project management unit. They have been working very hard to make this launch a success. For the past 1.5 weeks, they have been working day and night to make sure that this launch happens and is successful. And also, I would like to thank our friends, our colleagues from the non-government organizations, the community-based organizations such as MHEP, YMA, Mizoram Upapol, and others who have very kindly spared their very precious time to come and attend this session with us. And I was very afraid of forgetting them. That's why I wrote it down here. Officials from Mizoram House, New Delhi, have been very, very helpful, have been supportive in, whenever we went to Delhi, we need to get some letters printed, information gathered, information given out, and they have, provided the kind of support that I believe without which we would not have gotten this far, really, because, we cannot go to Delhi. Sometimes meetings are called in short notice, and Dr. Kimi from Delhi, she has always been very forthcoming in, attending these meetings on behalf of Mizoram government, and I think this is something that is completely indispensable. So, and then from Delhi side, I would also like to thank the Department of Economic Affairs, Ministry of Finance, for very kindly accepting our project to be funded through World Bank loan, which eventually they're going to help us repay back. I'm very afraid of missing out people, but I'm sure, I'm sure there are people who I might have missed out. But because this is the kind of support that this project has received, you must have seen from the project director's presentation how complicated the project is, and so to reach that level, we've had support from a number of people, and I might have missed out people, so I would apologize again, but at the same time, I thank everyone who has been involved for the support that they have given. Yes, the Joint Secretary of the Department, the Undersecretaries, and the Deputy Secretaries, we thank them for helping us move the files and making things very much easier for us. Apologize for anyone who has been missed out, any organization who could have been missed out, but we are eternally grateful for all of you who have come here and make this launch a success. Are we going to have a photo session with the minister? Yes. So we're going to have a photo session with the minister. Please do stay on for that, because that is going to be required. And yeah, so thank you everyone so much, and I hope you have a safe trip back to wherever you need to get back to. Yes, thank you.
Kung ngayon kan Director Health Services le Hospital Medical Education teka kan officials de bulakyanin han tawin tin picture number 1 akhanin kan newsletter release akha khongai takin king lam chewila khaka kan run request tu chewa newsletter kan release akha khongai takin minti lang sakula